Welcome to Hack Your Health with Dr. Nat, a transformative live stream TV show that brings wellness within everyone's reach. Each episode, featuring expert guests, delves into crucial topics like hormonal health, effective detoxification, and stress management through nervous system optimization. Gain practical insights into nutrition, supplementation, efficient workouts, and biohacking tools to enhance mental and physical health. So now, please welcome the host of Hack Your Health, Dr. Nat.
Hello, everyone, and welcome to Hack Your Health with Dr. Nat. I am your host, Dr. Nathalie Beauchamp. Welcome to the show. We have a great guest today and obviously a good topic as well. So we're going to talk about food. The question is, are you confused about what foods to eat? And this is something that I hear all the time with patients and clients. So today we're going to focus on nutrition and hydration strategies for optimal health and well-being. And my guest today is the co-author of my book, Smart Cut, Dr. Paul Sly. Welcome to the show, Paul.
Thanks, Natalie.
So we're excited today to cover this because this is pretty much section 2 in our book, Nutrition and Hydration. And Paul, you and I had many conversations for that chapter because it's so complicated. I always kind of used to joke that you could put all the nutritionists in the world in the Olympic Stadium in Montreal and they would agree probably just on one thing about the fact that greens are good for us. But even at that, with oxalate and so forth, that could be a bit debatable. So in our book, we don't say to people, eat this, don't eat that, but we want to talk about guidelines. So I think it's important to also understand that diets, first of all, I don't like that word diet. It just sounds so limiting. To me, it's a way of eating. It's a meal plan. And I think, Paul, you'll probably agree with me that at different stages in our lives, we might need different things. So I know at the age I'm at, I'm not exactly eating the way that I was. And also it's about how we feel. I think some people do better on a more carnivore diet. I know you have a tendency to eat way more meat than I do, not that I don't. And there are some people that thrive more on a vegetarian diet. So I think it's important to notice that how we feel in order for us to decide on a diet. And I also think that we have to understand that food is fuel. And this is how we nourish the cell. It's through a process called cellular respiration. And to make it simple, we grab the glucose from our food, transform it into ATP, which is the energy of the cell, which is needed for all the biological process. So, Paul, we had, it took a while for us to write that section, right? Because we didn't want to put too much. We didn't want to overwhelm people. And we also know that it always evolves. We learn more, we understand better certain reaction in the body, and we can tweak. So at the beginning of our book, each of the chapters, we ask discovery questions. So let's start with the same thing that we have in all of the chapters. So I'll let you cover those discovery questions because I think it's going to set the stage for what we're going to talk about.
Well, as you said, I mean, it is confusing and really nuanced, and nutrition is one of those, to quote Andrew Huberman, barbed wire topics that no matter what you say, you're going to tick somebody off. But you and I are pretty agnostic about any particular eating style. I think there's a lot of different ways that you can do it. But there are particulars that you have to pay attention to, and that's what we focused on. And I think that there's not too much to argue with that approach. I think when we looked at the discovery questions for people to assess where they were at the top of that list was, do you know what your optimal daily water intake is, and do you even know how much water you're taking in a day? Do you know how to adapt that intake to your amount of exercise activity, even what the ambient outside temperature is? Your protein intake, are you assessing protein intake, and do you know what an adequate protein intake for you is? Your daily caloric intake, do you take that in within an 8 to a 10 or maximum 12-hour period and allow your body 12 hours to absorb the food and your gastrointestinal tract a chance to regenerate? Do you spend at least 15 minutes? We really like this one with your bare feet on the ground and getting that grounding effect. Do you know if your daily calorie intake and food intake covers your needs in terms of micronutrients and assessing that? Are you taking any key foundational supplements? And we're going to talk a little bit about that later. Do you ever detect in yourself the symptoms of dysglycemia, of either high blood sugar or especially low blood sugar, being hypoglycemic, hangry, as they say? Do you eat probiotic rich foods to any degree? Does your diet support an ideal weight? And do you know what that ideal weight is? And do you periodically track your macronutrient intake? And on that point, I think it's something that I've done periodically, and there are a lot of really good apps out there that make this really simple. It's a bit of a chore. You need to weigh your food or measure your food, but to get into the habit of doing that for even a couple of weeks is really instructive, and I think that it can be quite surprising. I would bet that most people couldn't estimate their calorie intake, let alone their macronutrient breakdown within 20 to 25%, which is huge. And so I think that can be a really instructive practice to do.
Which application are you using, Paul?
We are going to name one.
Why not?
I've been using Chronometer, which is, yeah, we don't have any affiliation with them.
No.
It's a Canadian one. I have the free version, and it, as soon as you start to type a food in, it comes up with the options and even different brands, and then you can pick an amount or a weight or whatever the case is. And so it's quite intuitive and easy to use, and it will tell you at the end of the day not only your macronutrient breakdown, your calories, but it will actually give you a pretty good idea of micronutrients as well.
Yeah. So you're right. It is a bit tedious to do, but not a bad thing to do once in a while, to do spot checks, because I think most of us would probably underestimate the amount of food that we're eating. So let's dig into water and hydration. So I'm going to bring the first visual for this, because there are some key points that we want to address.
So water is so important, and when you consider this hierarchy, we can go an awfully long time without food, but only a few days without water. And so that highlights how critical it is. And it is important to consider filtering your water. We don't need to, and we could spend an entire show talking about tap water, but regardless of what your source is, just spending a little bit of time and potentially a little bit of money to have that assessed and know where you're at. At the very least, a charcoal carbon filter is a good idea, and at the top of the hierarchy is likely using a reverse osmosis unit and remineralizing that water, which is an important aspect of that. When assessing how much water you're taking in, it is important to consider that we do eat our water as well. Our vegetables, which you would imagine 90 to 96% water, fruit 80 to 90, but eggs are 75% water, meat even is 65% water. So we're getting a fair amount of water. If we're eating good quality whole foods, refined foods tend to be much lower in water. Don't drink your calories. This is a huge one. So many people reach for the pop the sugared sodas, even the sports drinks are pretty much along the lines of a pop these days. Um, we need to be drinking water or coffee or tea, maybe some kefir. The sugary drinks should be really few and far between. It's probably prudent to stay away from plastic as much as possible. There's so much controversy about that, but why take the chance? Um, Two that we highlighted in our book, because it is instructive to have a bit of an idea of amounts and where we're at. Andy Galpin is a professor of exercise science in California, and he came up with the Galpin equation, or it was so called the Galpin equation. He didn't name it for himself; somebody else did. But considering consuming your body weight divided by two, your body weight in pounds divided by two in ounces. So if you weigh 150 pounds, 75 ounces of water a day, which equates to about 2.2 liters. Um, in exercising, and especially in hot environments, but not only in hot environments, if you take your body weight and divide it by 30 in ounces, that's what you should be taking in every 15 minutes. And so you weigh 150 pounds, 5 ounces or 0.15 liters every 15 minutes. This is something you should be sipping away at, not gulping on the 15-minute mark, of course. This is sort of an ongoing, but that gives you an idea of where we want to be in terms of the water intake.
Perfect. And then this is a recipe that we have in our book, Smart Cuts, of a homemade electrolyte recipe. And I think you have an interesting story with an athlete that you're working with and how much she saw a difference, correct?
This is such a critical piece, and I guess I was mentioning to you one of the power lifters that I recently started working with, and she was getting some lightheaded symptoms with deadlifting and squatting, deadlifting especially. She had a competition on the weekend just passed, and so I started her a couple weeks ago using this, just the simple hydration with the electrolyte, the homemade electrolyte, and it just instantly took those symptoms away. Um, there's so much focus on low salt diets now, and people get caught up in that and not realizing that we need electrolytes. We need them for our nervous system to function. We need them for our blood pressure. Yes, a lot of people have high blood pressure, but postural hypotension, low blood pressure can be affected quite a bit, which is likely what she was experiencing. And so, there are electrolyte mixtures on the market. I always joke that this page in our book in 1 month would pay for the price of the book if you're using one of those that costs 50 cents to $1 a day and switching to this, which is pennies a day, using a good quality salt, a quarter teaspoon, a quarter teaspoon of Morton's light salt, which is a potassium chloride as opposed to a sodium chloride, and then a quarter teaspoon of just baking soda, sodium bicarbonate, and that gives you that nice ratio of electrolytes. And you could add a little bit of, especially if it's in a pre-workout, add a little bit of honey for some flavor, add a little bit of lemon for some flavor, and that's a great electrolyte mix.
Mhm. And I mean, this is great if people want to make it, but there's also, I know I'm a big fan of LMNT, especially because it's just in a nice little sachet and it's easy to grab on the go. We want to make sure when we choose those that are, we purchase directly to not have extra other things in there that we don't need. So I think keeping it simple with the magnesium, sodium, and potassium is key. So now let's dig a little bit deeper into each of the macronutrients. So the macronutrients are your protein, carbs, and fat, and the micro are the vitamins and minerals. So I'll get started with the next visual on the protein here. So if we can get that. Perfect. As I mentioned earlier, we did not want to take a side on any specific diet, but we really believe that there are some guidance or guidelines that we can follow that will fit most people. So proteins are basically the building blocks of our body. So we need to really prioritize protein. Obviously, better to have grass-fed, free-range meat, beef or chicken, pastured organic eggs, wild sockeye salmon, and full-fat organic dairy for the people that do dairy. And then the order does matter. So eat your protein, is important, and we're going to talk about that shortly. But the RDA, which is the recommended daily allowance for protein, we find it to be a little bit on the low side, and especially as people get older, we don't want to end up with decreased muscle mass or what's called sarcopenia, because it is so important to keep your muscle mass. It's such a huge marker for longevity. But what we recommend is closer to 0.5 to 0.7 grams per pound of lean body mass. So what it means is that if you're carrying on a few extra pounds, you don't want to take that weight, but you want to guesstimate what your ideal weight would be and do at least 0.5 to 0.7 gram per pound. I try myself to go as close as to 1 gram for every pound. What my weight is, especially as I'm getting older, and especially doing strength training and so forth. Also could be really interesting to add essential amino acids, and it's not just the branched chain amino acid, but all of them, to supplement those building blocks. And if people don't really know the difference between amino acid and proteins, a chain of amino acid will form the protein. So this is something that I do as well, to try to get in the amount of protein that I need in a day. I know, for example, today that I didn't have enough time to eat real food. So I did do a protein shake and a sachet of essential amino acid. So that's why whey protein can be a good way for you to increase your protein intake. And for the people that want to do non-animal, you can do pea or pumpkin protein to supplement as well. So this is, to me, looking back at this, the protein issue, this is something that I see so much, especially with my female clients. They're having a hard time losing weight. They're having they're tired all the time. They're having hormones issue. And then I have them write in a day what they eat. And it's pretty sad that sometimes it doesn't even pass the 30 to 40 grams of protein per day. So this is the first thing that I tell them, is to increase their protein intake, and they start feeling better pretty much right away. So Dr. Sly, I'll let you continue with the fats.
Yeah, and fats are so important, and often for the uninitiated get a bad rap, but we need fat. Young kids need fat for brain development. We need fat on an ongoing basis, but we have to be careful of the types and the amounts. We want to concentrate on good quality fats. When you look at the sort of fats that are in, for instance, avocados, animal-based omega-3, your sardines, your cold water fish, anchovies. If you're eating butter, and I love butter, it's great to look at raw, grass-fed, organic milk butter. Ghee is a great option. Olives have good fat. Eat the egg yolks. That's where a lot of the nutrients are, and we do need that good fat. And it's probably prudent to stay away from vegetable oils to a large extent, especially the linoleic acid, grapeseed, canola, all of those. Balancing that omega-6 to omega-3 ratio is really one of the critical pieces, and we have to be really careful on this. And when we were speaking about chronometer, that will actually tell you if you track what you've taken in the day, what this ratio is. It will show you your omega-6 and omega-3 amounts right side by side. The omega-6 oils are in the typical diet, things like salad dressings, fried foods, your grain-fed beef, and that tends to be more pro-inflammatory. These oils make up the cell walls, and we want more omega-3 in there, but they will use what you give it. And so the omega-3 oils are more the flax seeds, walnuts, grass-fed beef, fatty fish, and these tend to be anti-inflammatory. And we want that ratio to be at most 4-to-1 of omega-6 to omega-3. And the average North American diet is more like 25-to-1. It's huge. As a general rule, and again, you would need to be tracking to have an idea of this, but it's probably best to either your keto and your fats make up 70% of your caloric intake, or it's below 30%. And so again, it's another reason to do some tracking and have an idea of exactly where you're at.
Excellent. And when it comes to fat, I think too, it's important to realize what we're cooking with, right? So olive oil, not the best way to cook, because it's at high heat, it will disintegrate or get, change its property. So I know you probably use butter. I love ghee, or I don't know, never know how to pronounce it, ghee or ghee. But it's great for cooking, and we want to be careful about that vegetable oil for sure. So now let's go into. Go ahead, Paul.
So I was going to say, as a general rule, when you're cooking on high heat, the ghee, tallow, beef tallow tends to be a good choice, and coconut oil is a good choice for high heat. Avocado oil is medium heat. Butter is low heat. Nut oils, you're best not to cook with them, and then your vegetable oils, probably best not to use them, let alone don't cook with them. So that's kind of a general guide.
Yeah. All right, so now let's move to carbohydrates, fiber, and our microbiome. So I think, again, carbs have gotten, just like fat, kind of a bad rep, low carbs, and it has its advantages. And again, if somebody has dysglycemia, they may need to cut carbs to rebalance and regulate their blood sugar, but we should be able to eat some carbs. So we want to make sure that we're eating complex carbohydrates, and also really focus on fibers, eating fiber first on our plate, then the protein, then the fat, and carbs at last. And also in that order, so having that visual of our plate. And carbohydrates, as I mentioned, do serve as fuel. And we need to gauge it with the amount of physical activities that we also do in a day. And I myself do better eating my carbs later on in the day. It seems like it's helping me sleep better, as opposed to taking them earlier in the day, where it might make me a little bit more sluggish. Next, eating fermented food. You've hinted to that with sauerkraut, kimchi, kombucha, miso, or kefir. I'm a huge fan of fermented food. This is something that I do daily. And I believe it was mentioned probably a few times in the Huberman Lab podcast to do, I think it was 3 or 4 forks full, if you please, of fermented food daily can have a huge impact on the microbiome. And then nurturing your microbiome by eating a diversity of food. This is something that as human we do. We have a tendency to eat the same things often and repeat. I think I read somewhere that it's 30 foods that we constantly eat, and there's not enough variety. And probably for some people, it's not even 30 foods. So having a diversity of phytonutrients, which are the natural compounds found in plant foods, and have a diversity in color as well. Every fruit or vegetable has a different color and brings in different phytonutrients because of those different colors. So if I make myself a salad, I really try to have a diversity of color in my bowl. And same thing with what I eat on a regular basis. So I think this covers the carbohydrate. And I think now we can focus on food that can be a bit more inflammatory, because a lot of chronic diseases, unfortunately, that it is diabetes, heart issue, arthritis, are inflammatory diseases. And so many times, I'm sure you get that a lot, Paul, that some patients finally decide to say, okay, I'm changing my diet. And then they're like, wow, it really works. I'm less sore. My joints are less sore. Even today, I had a patient, kudos to her hemoglobin A1C, which is your 3 months status of your blood sugar and how sticky your sugar is to the protein. She was at 6.2, changed her diet, was able to bring it down to 5.6, I believe. So, this is her just changing her diet, and in a few months, I think it was 6 months that it took her to do that. But this is very much doable. So, Paul, I'll let you chat a little bit more about the inflammatory food that we probably should avoid, or at least be cognizant of.
Yeah, it's so difficult for an individual to know what to avoid. We talk a lot about what you should eat. Of course, anybody can have an individual reaction to virtually anything. And the gold standard to try to zero in on that is to do an elimination diet where you take out just about everything for a period of time and then add in one food type at a time. And that probably takes some guidance with a good naturopath or functional medicine doctor to do that and do it properly and do it safely. But there are some things that we need to be aware of, if only just to give you an idea that, gee, maybe this type of food is causing me a bit of an issue. Glutens in wheat are a big one. Nightshade vegetables, potatoes, eggplant, tomatoes tend to be an issue. We always see a lot of people with arthritis flare-ups in August when the tomatoes start to ripen, and people I love them myself, but
Yeah.
some people have to be really careful. Any processed food, an artificial food, anything with an ingredients list, anything in the middle of the grocery stores are apt to be an issue in terms of sensitivity and problems. Sugar, of course, processed sugar, refined sugar. This is something that we really should be watching and be careful of. Lectins in vegetables especially, people have to be careful with that. And then, of course, dairy. The two that jump out that people tend to have the most trouble with are glutens and dairy. And in a lot of cases, in maybe the majority of cases, just taking those out of the diet completely for a period of time and then trying reintroducing one or the other, and then maybe doing it again to reintroduce the other one is probably a really good idea, and that can be really instructive in terms of what you might be sensitive to.
Mm-hmm. And you're right, the elimination diet is the gold standard. There's also food sensitivity test, and you need to make sure that the company in the lab that does it, because some of them are better quality than not. And I would also add to that soy and corn. So a good elimination diet is gluten, dairy, corn, and soy. You start reintroducing it after 30 days, and I always joke, you're not going to order a pizza with everything on it, because then you're not going to know what you're sensitive to. So it's slowly reintroducing those, and in conjunction with a gut repair program, something like glutamine. There's different companies that have good quality supplements to help repair the gut, and the fermented food would help with that as well. So, Paul, we're going to take a quick break, and when we come back, we're going to talk about micronutrients, vitamins and minerals, and we're going to talk about the basic foundational supplement, because it was not easy for us to pick the foundational supplements, because there's a lot out there, and we didn't want to pick too many to have people overwhelmed. So we'll be right back.
In today's world, the flood of health information feels endless. But amidst the noise, two experts with over 50 years of combined clinical experience come together to help you with Smart Cuts, biohack your health span, cutting-edge protocols for greater energy and performance. Dr. Paul Sly, a beacon for athletes, weekend warriors, and those seeking to elevate their potential. And Dr. Nathalie Beauchamp, renowned for empowering individuals in their health journeys. Together, they've produced the book, Smart Cuts, Biohack Your Health Span, a protocol-based treasure trove packed with actionable steps. Journey through 5 transformative sections. Dive into sleep, hydration, movement, brain health, and even the secrets of longevity. Guided by their expert hands, unleash the best version of yourself. With over half a century of clinical wisdom and innovative protocols, reclaim your health and redefine your limits. Are you ready to embark on this transformative journey? Smart Cuts, available now.
Welcome back to Hack Your Health with Dr. Nat. We are talking about hydration and nutrition. My guest today is Dr. Paul Sly, the co-author of our book, Smart Cuts. So let's dive in a little bit more into vitamins and minerals. And we're not going to go in too much details because that can get really granular and we don't want to spend too much time on that. But how do you know you're deficient? Well, I think we have to realize that unfortunately, the quality of our soil is not what it used to be. So I'm a big fan of having a good multivitamin, high quality with not a lot of fillers, because we don't know if we're covering all our bases. There are some blood work that you can do. So the basic blood work that you get, during your annual physical exam will tell you a little bit about deficiency, let's say iron, vitamin B12, and potentially vitamin D if it's tested as well. But they are very limited. There are other tests that you can do, that you can purchase through different labs, through the naturopathic doctor or functional medicine. One of the one that is well known is called an acid organic test, or also a metabolomics test. Companies like Genova can do that. So it is either a blood draw, or the metabolomics is a blood spot that you send to the lab, and it will be able to tell you all of the minerals and the vitamins that you're deficient in. And there's now even companies that you can use to develop your own formula based on those lab results. So talk about, specialized medicine and medicine or supplementation that is really specific to your needs. So something that you can definitely do as well. So Paul, I'll let you jump into the next topic, which are the basic foundational supplement that we agreed on. And as I said, we just didn't want people, first of all, we need to get the most of our nutrition from real food. I think we can all agree on this, but some basic supplementation, and I mentioned a multivitamin, but we're going to talk about other foundational that we encourage. So let's bring the visual of the top 4.
Yeah, I think that with what we've talked about so far, I love that old saying that calories determine what you weigh. Your macronutrients, proteins, carbohydrates, and fats, really determine how you look at that weight. And then your micronutrients determine how you feel at that weight. And when we think about supplements, it's mostly micronutrients, though the first one, for years, when people would say to me, if I'm only going to take one supplement, what would I take? I always said an essential fatty acid, an omega-3 fatty acid, an EPA, DHA supplement, a cold water fish oil supplement. This is probably the biggest thing, unless you are really unusual and eat large amounts of fish, fatty fish, salmon, uh, anything like that. I eat sardines a lot. I like them. I'm lucky. I like them. Drives my kids crazy. My wife doesn't like the smell of it. I have to be really, really careful how I get rid of it in the cans after I have it. But this is a really important part of our diet and something that's not taken in an adequate amount. So that essential fatty acid supplement is a huge one. Vitamin D, and this got a lot of press through COVID. People who had low vitamin D status almost invariably did more poorly than people who had a good vitamin D status. The magnesium intake in the North American diet, in the standard North American diet, tends to be quite low, and it really is a critical nutrient for a lot of other things, including blood sugar regulation. And so a magnesium supplement, a good quality one, is a really good idea. And then something that's come to the forefront is a creatine monohydrate. The studies over and over again show the safety of this. People used to get quite excited about whether it was hard on the kidneys, and that's been proven to not be the case. And in fact, there's been some really good Canadian research. A Dr. Darren Candow, who I believe is at Winnipeg, has done some of the forefront studies in this, and it's probably one of the most studied and safest supplements. And it was always considered to be a muscle building supplement, and it is, but there's more and more evidence all the time that it's a brain supplement. It's really good for cognition. Even there have been some recent studies that have shown that with a lack of sleep, just an acute lack of sleep, taking a high dose creatine can help to offset some of the effects of that. And so I think that the creatine is it's cheap. I mean, plain creatine monohydrate, which is what all of the studies use, it's probably one of the most inexpensive supplements that you can get. So I think you're missing out if you're not taking that. And collagen is a good one. I like to get my collagen in bone broth, but there are good quality collagen supplements as well. It not as a protein supplement. You might as well just use whey protein, but collagen is a building block, and with skin health and tendon health, I think that's a really good one. Vitamin D is one. If we could flip to that slide showing the vitamin D levels, it's probably really prudent to test your vitamin D. It's pretty easy and relatively inexpensive to do. And Natalie, you and I were kind of classic cases of this. I spend a lot of time outdoors. I try to expose as much of my skin to the sun as I can, prudently and carefully. I'm not advocating burning, and I'm careful of that. But that's something that I really do a lot of. And despite that, when I had my levels tested about 2 years ago, I was in the normal range, but I was low normal, much lower than I would want to be. And I know that you had a test done and you were off the charts high. So I increased my vitamin D supplementation to try to get more into the mid to high range of normal. And I know you had to stop taking it to try because you were so high. So I think that it's prudent to test and not guess and know exactly where you're at.
Yeah, and I agree that what we measure, we control and we know. And I think it's important that The nanomole graphic that we have here is in Canadian. There's a bit of a difference with the US, so do pay attention to the lab range. And, I think it's important to know your numbers, because oftentimes we get blood work done. Yeah, your numbers were all good. Well, like Dr. Sly was saying, you don't want to be in the low normal. So really knowing where you are, then you can decide. And if you're really low, you might really need to go to 5, 7, 8, even 10 international unit for a while to replenish. I always suggest testing at the end of the summer, because technically our storage should be full. So if at the end of the summer you're still deficient, well, then you know that you need to be able to supplement. Most annual evaluation will test for vitamin D, but not always. So this is something that I think should be part of the testing. So let's now talk a little bit more about fuel in general. And on a previous show, we talked about metabolic flexibility. As I mentioned earlier, we use glucose as fuel. And when we're in a ketogenic state, that means that we're using ketones, which are acid that our body makes. And when it breaks down the fat, we can use those two types of fuel. But it is challenging for people to be in ketosis. Again, if somebody is overweight, has dysglycemia, and needs to really work on their metabolism and stabilizing it, sometime using what we call ketone, exogenous ketone, so ketone that we can consume, can be valuable. So there's two types. There's the ketone salt, and those are beta hydroxybutyrate, and they're bound to either a calcium, a magnesium, or a sodium. So they're a little bit less absorbed well by the body because they need to be broken down again in the body. And some of them can cause a little bit of GI distress if taken. And then on the other side, there are some ketone ester that are pure BHB, which is, again, that beta hydroxybutyrate. And they are more available to the body because they're attached to a precursor and easier to get absorbed in the bloodstream. So, and once in the liver, those ketone ester are broken down so they can be used for fuel. So there's a lot of tools now out there that we can use to help stabilize our metabolism and be able to decrease inflammation in the body. But again, there's a lot that we can do with food. We're going to talk about time restricted eating in a few minutes as well. Paul, in our book, we have a bit of a segue or a section, a calorie is not a calorie. And I know that I even wrote a blog not too long ago. If people want to go and find it, I believe it's called Beyond Calories, Unraveling the True Impact of Sugar and Processed Food on Metabolic Health. And I got inspired writing that blog, listening to Dr. Robert Lustig, who was interviewed on the Huberman podcast. And it was really great information that he shared, that a calorie is definitely not a calorie. And one of the things that he said, a calorie burn is a calorie burn, but a calorie eaten is not necessarily a calorie eaten, because the body will use it differently. So let's go back to the slides here for the next visual, because I think it's important that we dig a little bit deeper into this. So these are the factors that can influence our response to a calorie that is from different sources. So different metabolic pathways, different types of calories are metabolized differently by the body. For instance, simple sugar like fructose are primarily processed by the liver and are more likely to be converted into fat, while calories from complex carbohydrate, as I talked about earlier, or protein follow different metabolic pathways, often used more even efficiently for energy. Then there's the insulin response. So the type of food consumed can also impact insulin level. food that is high in refined sugar and carbohydrate can cause spike in insulin, which is a hormone that facilitates the storage of fat and the release of glucose in the blood. And conversely, food high in fiber and protein generally result in a more moderate insulin response. And that's why we were talking about the food on our plate, to start with the fiber, start with the protein, the fat, and the carbs, because this way you're not going to generate as much spiking into your blood sugar level. Then we have the thermic effect of foods. Different food require different amount of energy to digest, to be absorbed, to be metabolized. For example, the body uses more energy to process protein compared to fats and carbohydrate. And, that's probably due to the fact also that the protein are such an important building block. So this means that even if two foods have the same number of calories, the net energy gain for the body can be different. And I remember Dr. Lustig saying that about 10% of the calories we consume are used just to maintain body temperature. So the thermic effect is huge. And then satiety and hunger signals. So food that are high in sugar content, especially the processed food, can disrupt normal hunger and satiety signaling in the body, which may cause us to overeat. So this is really important. And again, food that are high in fibers, protein, and healthy fat, they will keep us more full, and it will help us regulate our appetite. And then nutrient absorption, not all calories consumed are fully absorbed by the body. The presence of fiber in the diet, for example, can reduce the absorption of some calories. And then lastly, there is a long-term metabolic effect that the quality of calories consumed can affect long-term metabolism. So a diet high in sugar and processed food can lead to insulin resistance, leading to diabetes, obesity, metabolic syndrome, where a balanced diet can support a healthy metabolism. So for some of us that were thinking that a calorie was a calorie, it is definitely not as simple. So that's why, I'm not a big fan of counting calories, because I think there's a huge amount of factors to take in consideration. And I think I would be much inclined to count the macro, the micro nutrition, so you can see if you're doing the right thing. So leading into, the pre-diabetes and diabetic as well, or diabetes, Paul, let's talk a little bit more, because we touched on this in the book, and I think it was also a protocol on how people can help and what they can do to regulate their blood sugar.
Yeah, it's such a critical issue and so damaging. And I think a lot of people, this is one of those areas in medicine now that with the overworked and the focus on disease care, this is one of those areas where people's blood sugar will slowly sneak up and up and up. And this happens over a decade or more. And then all of a sudden, they're pre-diabetic. One year their A1C was 5.6, and then all of a sudden it's 5.8, and they're pre-diabetic. Well, it's been sneaking up over a decade, and it would have been prudent to know that and maybe make some changes beforehand. And so there are a lot of things that people can do. One of the things is, of course, having that blood work done and seeing where you're at in terms of A1C, and depending on your physician and their philosophies, they may do a fasting blood glucose and or fasting insulin level even. But you can get access to now continuous glucose monitors that they're not inexpensive. They're about $120, I think, for a 2-week period to buy one at the grocery or at the pharmacy, and there are places you can do it online. But doing that once or twice a year even, and being careful and tracking what you're eating at the time would give you a really good idea of what your glucose response is to certain foods, and even the order that you eat those foods in. And that can be done with a manual monitor and pricking the finger as well. Much less expensive, more laborious. You have to do it and do it at certain periods, 1 hour, 2 hours after a meal, and seeing what's happening. Do it first thing in the morning and see what your fasting blood sugar is like overnight. So those are ways of tracking it and seeing exactly where you're at. And then things that you can do to control that blood sugar. You mentioned the order of food that you eat, and so keeping the carbohydrates until last, eating your foods that are more rich in fiber, maybe the high water content vegetables that are on the plate, and then keep the rice until last. So if you've got a traditional plate with a high water content vegetable and a meat and some rice, well, you would have the high water content vegetable and the meat and then the rice last. And that can make a profound difference in the blood sugar spike from that rice, from any complex carbohydrate. Apple cider vinegar is a really interesting one. Having a tablespoon of that in a glass of water before the meal can really reduce that blood sugar spike. Going for a walk after a meal, 10 minutes, 20 minutes, just a nice walk, get outside. That exercise triggers your body to burn that fuel, and it keeps the blood sugar spike from getting too high. And there are some things like some natural things like berberine. Berberine is a really interesting one. They call it kind of the natural metformin. It can have a profound effect on blood sugar levels. And in fact, people have to be careful. It can lower it quite profoundly if you're susceptible to it. And so a trial of that, if you're having some issues in that pre-diabetic range, might be a good idea. So those are some of the things I think that you can do to try to level out that blood sugar on a daily basis and with your eating.
And then just before we go a little bit more in the intermittent fasting, we talked about the fermented food. So prebiotics, probiotics, postbiotic. I mean, we cannot talk enough about our gut. And unfortunately, again, it's not necessarily that I want to blame it on age, but it's easy to have, a less than optimal diet, and then things can really creep up on you. And the next thing you're just having gas or constipation or diarrhea. So you really need to pay attention to that. Glutamine, as I mentioned, butyrate is another one that I personally use, and it's good to, it's a short chain fatty acid, and it's good for the junction and keeping the lining of our gut in good health, because this is when you become sensitive to certain food, because there could be gaps into the membrane, the food leaks out into the bloodstream, and then this is how you react to some food. And same thing, and I think we probably, I'm planning on having a holistic dentist on the show, because the oral microbiome is also very crucial. We're both a fan of oil pulling, no mouthwash that is full of alcohol, because we need that microbiome. So yes, you want to have fresh breath, but there are other ways to do it. And unfortunately, a lot of the toothpaste out there, a lot of the mouthwash are actually really not good for us from that. So anything to add on your oral hygiene, Paul?
No, I think that's really important, that the especially the strong mouthwashes, and in fact, Andrew Huberman had on his podcast, he did a whole podcast on this, and one of the things they highlighted was the negative effects of those alcohol based and strong mouthwashes, and what the alternatives are, and that the fermented foods is such an important piece to the diet too. I think, again, regardless of what your eating style is, studies have shown really positive effects on mood, even, which isn't something that you would think about with probiotic foods, but 4-ounce servings a day seems to have a huge effect on that. So I think that's a really important piece of diet.
Well, that gut brain axis, right? The vagus nerve. And, we have some on a in our book on that. So let's just touch upon, because I'm sure people it's not new to them, but let's bring the visual up here on fasting and time restricted eating. We like the term time restricted eating. So it's about restricting your eating period or window to a set time. So 8 hours, for example, and if you are sleeping 8 hours a night, you are, doing time restricted eating. But having it going longer is good because it has a multiple, many benefits, from starting autophagy after 17 hours, a gut reset about 24 hours, fat burning with 36 hours, dopamine reset for 48 hours, and an immune reset for 72 hours. Now, I'm talking about the longer fast, and it's not for everyone. Listen, if your cortisol is, low, and you're not sleeping properly and you're tired, long fast, especially for women, may not be the right thing to do. So you don't want to start with that. But I put this there just to show you some of the benefit of restarting the body, or creating autophagy, which is basically your body being able to clear the cells that are not healthy in your body. But starting small, to, let's say, instead of having breakfast at 8, you decide you have it at 9, you keep pushing it to 10, you keep pushing it to 11. All of this will help you achieve better flexibility, metabolic flexibility. And also there are some diet or meal plans that are called a fasting mimicking diet that you can add similar results. All right, my goodness, we have just a few more minutes left. And because we're talking about fuel and energy, I think it's important you touched upon grounding, but light exposure, all through our book, we talk about that to, get outside first thing in the morning and get grounded. And I know you live in the country, so I'm always envious of you, especially in the summer, for you to go outside, drink your coffee in your barefoot, and just ground. And I myself, right now, I'm standing on a grounding mat. It's not as good as grass, but this is something that, I've been using, even grounding bed, mat and sheet, because we're many of us even work in high buildings, and we're not touching the ground. We're not touching the elements. So I know, Paul, lastly, tell us your routine on your grounding.
Yeah, I love my morning sunrise, and if I can get out there this time of year. Of course, I'm at work a lot of the days when it comes up in the wintertime, but now I can get out and have my bare feet on the ground, and get those rays of sun. And I think both the sunlight on the skin and the sun into your eyes and setting that circadian rhythm is so important. That low solar angle light, I find a huge difference in doing that, and being able to have my coffee out there this time of year is fabulous. And we are portable electronic devices, I think, and that is where we get our energy. We get it from food, from water, from the ground, and from the sun. And so I think that those are important aspects of our health, and just being more in touch with nature. We're far removed from the way that we evolved, and I think that just a little bit of getting back to that can make a huge difference.
Sounds awesome. So for people that want to dig, a shameless plug for our book, Dr. Sly has his in the back. So we covered a lot of stuff in section 2, and Dr. Sly will be coming back in a few shows where we're going to focus on movement and exercise. So I'm excited to cover that. But you can get the book on Amazon. It's easy, it's protocol based. I know we're sounding like we're promoting our stuff, but we've done it for ourselves, for our patient, and we've gotten great feedback because it deciphers a lot of the information, because it can get so confusing. So thanks again, Dr. Sly. We will see you on another show soon, so we can go over movement and exercise, because I know it's another area of passion of yours. So thank you so much for, thanks, Paul. Thank you so much for tuning in. This was Hack Your Health with Dr. Nat. Hopefully you learned a lot today, and you can start implementing slowly but surely the stuff that you implement. Remember, Rome wasn't built in one day. So anything that you learned tonight, or whenever you're watching the show, just start implementing 1 or 2 things, and you will see some changes. So until next show, stay well. This was Dr. Nathalie Beauchamp. Thank you.
Welcome to Dr. Nathalie's 7-Day Hack Your Health Challenge. Transform your fitness level with 7 quick, do them from anywhere workouts. Look and feel great. Nutrition. Master the art of optimizing your diet and maximizing nutrient intake with daily nutrition challenges. Biohacking. Unlock exclusive content to tap into your body's innate wisdom. Take on challenges to optimize your mindset and physiology. Ready to transform your health? Visit www.drnat.life to join Dr. Nathalie's 7-Day Hack Your Health Challenge. Your journey begins now.
This has been Hack Your Health with Dr. Nat. Tune in each week and uncover simple yet powerful strategies and actionable steps to elevate your health and wellness.